And thank you for joining us on day one of TIA's Network of the Future Conference right here in Dallas, Texas. Joining us is Dr. John Mattison. He's the Chief Medical Information Officer at Kaiser Permanente. And John, welcome to the program.
Thank you very much. Pleasure to be here.
It's a pleasure to have you. It's an honor, I have to say, after listening to the panel discussion earlier this morning. You're involved in a number of really interesting endeavors. I couldn't possibly touch on all of them today, but I think for our viewers it'd be beneficial to get that 60,000-foot assessment from you about the trends in the e-health market right now.
Sure, there's a lot of hype in many of the big trends in technology and particularly in healthcare, but it's my own personal belief that the hype really underestimates what's ultimately going to happen in terms of the application of technology in healthcare. And one of the things that I really like to think of and how I frame all of the various technical opportunities in healthcare is that we need to use modern technology to restore some of the ancient wisdoms. So a lot of the problems we have with healthcare outcomes and quality and cost today are related to our lifestyle and disorders of our lifestyle. So the obesity and diabetes and heart disease and stroke and cancer that we're experiencing epidemics of derive from decisions in our daily lives. Doctors and clinics and hospitals have very little influence over what we do in our daily lives. It is pervasive, high bandwidth access to information resources, big data analytics, predictive analytics, that is going to allow us to have support for our daily decisions to help us live healthier lives and ultimately achieve more mindfulness so that we can restore some of the ancient wisdoms that have been associated with longer, healthier lives. So one of the things that I really envision and one of the big demands of the telecom industry is very, very high bandwidth to support the kinds of avatars that are going to be very humanized and very personalized, because our genetic constitution has led us to be most responsive to human cues to adapt our behaviors. And so there's a whole lot of startups in this space already that are looking at how do we use avatars real time to extend the reach of health and wellness from clinics and hospitals to our daily lives where we live, work, play, learn, and worship. And it is that pervasiveness and that low latency, high capacity that's necessary to support the human face of a personal coach towards health and wellness.
John, you talked earlier again in the panel discussion about the importance of proactive medical treatments rather than reactive medical treatments. How does telecom play a role in that?
It plays a huge role, because when a doctor says, you know, you need to lose weight, you need to stop smoking, you need to stop drinking, you know, a six-pack every Saturday, and the patient leaves the clinic, it's like, you know, in one ear, out the other. And so what we really need to do is to be able to extend those micro-decisions support and behavioral supports outside of the clinic. So we want to take the 99.95% of our lives where we make the decisions that affect our health and wellness, reinforce it with those infrequent visits with a doctor, because there is a great power of a physician providing that kind of advice, but only if it's reinforced outside. And the role of telecom is to provide the bandwidth for the kinds of applications that are emerging and the kinds of avatars that are going to be our personal assistants in making healthy decisions. So it really is extending the reach of the best health and wellness and medical information to every individual at the point of making the micro decisions which collectively add up to our health and wellness. And one of the most fascinating things is there's been a lot of research in the past on what are called blue zones. And these are areas in the world, in Costa Rica and Japan and various parts of the world, where people, small communities, live long, healthy lives. And we've not been able to distinguish anything genetically different about them, but we have been able to distinguish characteristic habits around healthy eating, healthy exercise, healthy sleep, and most notably, healthy social relationships. And expressing empathy, compassion, and love and experiencing that has a profound influence on the regulation of our genome on a healthy pathway. So we put more years in our life and more life in our years. And what I see as the opportunity for technology is to take some of those learnings and to be able to bring the kind of behavioral support to every individual through the carriers to our mobile phones, to the applications that help mentor us, whether it's an avatar or an app for managing our diabetes or asthma or whatever it might be. But health and wellness and disease management all require high bandwidth, low latency to be able to support us in our daily lives. And I like to think of the smartphone as a stationary device. It's considered a mobile device, but in fact it's the most stationary thing in our lives, because wherever we are, there it is. And so I think if we flip that perspective and say that our smartphone is our personal assistant in every aspect of our life, including health and wellness, and we can use the benefit of big data analytics and predictive analytics to help support our decisions, I think that we will be able to really move the needle to use that modern technology to restore some of the ancient wisdoms as revealed in the Blue Zones.
John, as I mentioned before, there's so many layers and nuances to the work that you do. Certainly, we'd like to talk to you again. Unfortunately, today we don't have enough time, but we would like to do that. So we appreciate your time. Thank you.
It's been my pleasure. Thank you very much.
Thank you very much. And thank you for joining our coverage of TIA's Network of the Future conference. The Dell TI Now studio will be streaming live throughout the conference. You can view our live stream and all of our programming at tianow.org. So long.